happened in another room, and I could hear her crying. It was so awful.
She had so many wires and lines going into her.
My stomach just sank at that point. We really thought we were going to lose her.
I would literally jump out of my skin. The pain would send kind of shock waves through my body.
It was really difficult to grasp the idea that my mom was hurting for so long.
I was really concerned. She couldn't seem to get away from the pain.
I didn't want it to win.
They pulled us aside and they said, we've pretty much done all that we can.
Next, 2 medical mysteries that defied the experts.
Since the day she was born, Avery Williams has not stopped screaming, and no doctor seems too concerned. But when her little body begins shutting down entirely, her parents suddenly find themselves in a race against time.
We were devastated.
I just kept thinking, what can I do with her before she dies?
Then, Sue Ingraham's seemingly perfect life is turned completely upside down by a relentless series of attacks that push her to the brink.
I didn't know what the future was going to hold. I just didn't know how I was going to deal with all of this.
Almost as soon as Idaho Falls natives James and Amber Williams tied the knot in 1996, they couldn't wait to start a family.
Ideally for us, 2 boys, 2 girls just sounded perfect.
James's wish started to come true in 1999 when their son Christian was born. 10 months later, their daughter Taylor joined the family. And that next winter, Amber was pregnant yet again.
At first, I was kind of nervous because I wasn't quite ready. I had 2 little babies at home, but I knew I could handle it.
On August 9th, 2002, the young parents welcomed their second daughter, Avery, into the world. She weighs a healthy 7 pounds, 2 ounces, and immediately captures her father's heart.
There's something about daughters even a little bit more than sons as a dad where you just don't want to really say you love them just a titch more, but I guess you kind of do.
But from the moment she's born, it's clear that Avery is unlike their other children, who were extremely passive newborns.
The first night, Avery cried all night long, which was so different than my other kids.
And we kind of dismissed it that she was just maybe a fussier baby than our first 2 had been.
The next day, while Amber is trying to calm her daughter down, she realizes that Avery's eyes look very strange.
And I noticed that the whites of her eyes seemed to be robin egg blue. I thought, boy, am I imagining this?
Alarmed, Amber calls the doctor to find out what's going on. But after giving the infant a thorough head-to-toe exam, he assures the family that there's nothing wrong with Avery.
He thought it looked a little bit off, but there was no specific alarm that went off in his mind.
The next morning, Amber and James take little Avery home to meet her brother and sister. It's a joyful day for everyone. But almost as soon as they walk in the door, Avery begins to wail, and it doesn't stop.
When Amber called me to tell me about Avery crying a lot, I was just like, not really concerned.
My mom reminded me how colicky I was as a baby and that she would carry me around for, I don't know, the first weeks to months of life just to be able to get basic things like dishes, laundry, anything done.
But with each passing week, Avery's blood-curdling screams only seem to get worse. And every day, by the time evening rolls around, Amber is exhausted and at her wit's end. Then one afternoon, after putting Avery down for a nap, Amber notices that her daughter's features seem to be changing.
The shape of her head was a little bit off. It was a little bit bigger on top, and her forehead started getting bigger.
We didn't really discuss or talk about a lot, but it was something that we did both notice.
I just kind of blew it off as not wanting to be critical of my baby.
Amber never thought she would be the kind of mother who cared about her child's appearance. But when the veins in little Avery's head start to protrude, she can't help but acknowledge how freakish she looks.
People were starting to say, wow, she has big veins in the side of her head. So, you know, we were like, ooh, that's weird.
It almost looked like as if someone had taken a blue crayon or marker or something and drew them right on there with purple or blue.
During Avery's next regular checkup, Amber points out the peculiar veins. But the doctor promises her that it's nothing to be concerned about. Avery is perfectly healthy.
You know, I didn't want to be a hypochondriac, and I didn't have a medical degree.
But when Amber notices that her 4-month-old is still fitting nicely in her newborn onesies, she begins to worry that Avery may not be meeting her milestones. Concerned, she takes her daughter back in to see the family pediatrician.
He got out the weight charts and he said, she's still on the charts, but let's keep an eye on it. In the back of my mind, the whole time, I knew that something was off with Avery.
Then, on December 8, 2002, Amber's worst nightmare comes true.
I just woke up more from a bad feeling than something that woke me up.
But nothing could have prepared her for what she sees next.
Avery had labored breathing. She was just wheezing.
She couldn't even cry very easily like she usually did because she just couldn't get enough air.
My stomach just sank at that point. We really thought we were going to lose her.
In 1989, 34-year-old Sue Ingraham was living a seemingly perfect life in Northern California with her husband and 2 young children. Over the years, she'd become adept at juggling a very busy schedule, taking care of her family, teaching at a local elementary school, and making time to stay fit.
I ran 5 to 6 days a week. I eventually worked up to 4 miles a day.
Every morning, she would get up at 4 or 5 and she would go run.
But one day in the fall of that year, after returning from her daily run, she notices a strange sensation in her left foot.
The pain was like I was walking on a marble.
An experienced runner, Sue is no stranger to aches and pains. But she's never felt anything like this. Hoping for some relief, she replaces her sneakers with a new, more heavily padded pair.
If I didn't have some kind of a cushion on the ball of my foot, I could feel that marble-type feeling.
But over the next few weeks, the strange pain becomes nearly unbearable.
I stopped running and I switched to riding my stationary bike. And so I would get on my bike and ride for about 45 minutes.
Then, a few weeks later, when she least expects it, Sue's blindsided by an entirely new problem.
All of a sudden, my knee just froze up. And when I got off of my bike, I noticed that I couldn't bend my knee. The pain was too intense to even try. And my hip was having a lot of pain, a lot of pressure. After a few weeks of dealing with all these different symptoms, I made an appointment with a local orthopedist, and I explained my exercise routine.
The doctor listens carefully and performs a complete physical, but it doesn't take long for him to reach a diagnosis. The years of running have finally caught up with Sue. She has bursitis.
They explained that bursitis is kind of an inflammation in the joint area, and he thought I had bursitis in my hip, and I was just having some arch problems from the running.
The doctor prescribes a high dose of ibuprofen to alleviate the inflammation and recommends physical therapy. He assures Sue that her symptoms will go away in a matter of weeks. But they don't.
I tried everything they gave me. I went to see the physical therapist. The ibuprofen would take the edge off, but nothing really seemed to make things better.
Sue does her best to manage the pain and adjust to her new physical limitations. Then, in the winter of 1992, life offers up a challenge of a different sort.
My husband was offered a job in Washington State, and so we moved to Kennewick.
Sue begins working as a teacher's aide at a local school and quickly makes friends with a neighbor, Nanette Olson.
She had a couple little girls, and we became friends. We just happened to like each other's company.
We walked every day, usually 5 to 6 days a week. Pain wasn't too bad. But as time went on, the pain started becoming more intense.
I would look at her, and you could tell that something was wrong.
I always felt like there was something growing in there, like somebody was slowly inflating a balloon.
Seriously concerned, Sue makes an appointment with her family physician. And after performing a careful examination, he offers her a diagnosis that takes her by surprise.
He basically told me that I was getting old, even though I was only in my 30s at the time.
She was way too young for him to make a comment that her pain was due to aging. Besides that, a lot of her symptoms started years before.
I kind of felt that was ludicrous because I was in good shape. To me, I felt I was too young to be experiencing old age symptoms.
Sue leaves the doctor's office convinced that she has little choice but to simply grin and bear it.
My family knew about the pain, but I really didn't make too big a deal out of it. I just didn't want to worry them. There wasn't a whole lot they could do, so I didn't share with them too much about it.
But over the next 12 months, Sue continues to deteriorate to the point where she can no longer perform basic movements.
I had to kind of sit down very gingerly because otherwise I would literally jump out of my skin because it would send kind of shock waves through my body. When you live it every day, pretty soon you just learn to deal with it. I still had a job to go to. I still had children to raise, a husband, a house to take care of. I didn't want it to win.
But as the years go by, the pain grows sharper, more excruciating, and ever more present.
I would wake up sometimes every hour, sometimes every couple hours. It was constant tossing and turning.
She couldn't seem to get away from the pain.
I just had a lot of very intense pain in my hip. Life as I knew it was changing.
Since the day she was born, Avery Williams has caused a stir. She cries incessantly for no apparent reason. She isn't gaining weight like she should. Even more alarming, she has bizarre protruding veins popping out of her forehead. Still, no doctor seems concerned. But now, to her parents' horror, she can't seem to catch her breath.
I raced her into the doctor as fast as I could, and I set her on the table. I undressed her.
As Amber downloads the pediatrician on Avery's breathing problems, he tests the infant's oxygen levels. The results are shocking. She's barely able to maintain a 90. Healthy children can easily score a 98. The blood drains from Amber's face when the doctor tells her that she needs to take Avery to the hospital immediately.
My mind just, snapped. I couldn't imagine that I had been neglecting her enough in my mind that she got so sick she needed to go to the hospital.
The doctor is extremely worried that little Avery is suffering from a respiratory infection that could turn deadly.
I remember distinctly answering that phone, and they were so concerned.
At that point, I was terrified.
The doctor on call orders a series of blood tests and an X-ray of Avery's tiny chest, hoping to find some clue as to what's causing her so much distress. 6 hours later, when the findings come in, the doctor knows he's found the evidence he's been looking for. Avery's white blood cell count is alarmingly high, a clear indicator of several potentially life-threatening diseases.
They thought that might be a sign of meningitis.
We were horrified.
Meningitis is an inflammation of the meninges, the membranes that cover the brain and spinal cord. It is usually caused by bacteria or a virus, and left untreated, it can be fatal.
The next thing he wanted to do immediately was to perform a spinal tap.
This was something Amber and I had never experienced ourselves before, and here they were doing this to our 4-month-old daughter.
It happened in another room, and I could hear her crying. It was so awful. I just plugged my ears.
After carefully drawing cerebral fluid from Avery's spine, the doctor sends it off to the lab to be tested.
At this point, Amber and I both really just wanted to have an answer.
Now, the young parents can only wait for the results.
It was just a terrible, terrible night for us.
This was something that doesn't happen to one of our kids.
Being a grandparent sometimes is more difficult than one would think, because not only do you watch your adult children suffering, but then you're watching your grandchild too. So it's kind of a double whammy.
And just when they think things can't get any worse, the doctor drops a bombshell.
The next morning, our pediatrician said that she did not have meningitis. He said the next thing we need to check for, it could be the C word or the L word, which was cancer or leukemia.
We were devastated. Things seemed to be going from worse to worse to worse.
While the news sends the family reeling, the medical team is focused on figuring out the next step in their investigation before Avery's condition gets any worse.
At this point, our physicians in Idaho began to consult with doctors in Salt Lake City. They wanted to talk to some specialists from pediatric oncology.
The clock is ticking as the Salt Lake City doctor begins to review Avery's case. And when a radiologist identifies a mysterious pattern on her chest X-ray, he immediately informs Avery's doctors in Idaho that he's found a critical clue.
And they wanted to get her down there to Salt Lake City to see the specialist.
Within the hour, the team has Avery in an ambulance. Amber is by her side as they begin the 250-mile journey to Salt Lake City. Following the flashing red lights in his own car, the harsh reality begins to sink in for James.
I already knew that things were bad, but this just seemed to be continuing once again to just be another level of escalation, and it just seemed to be getting scarier and scarier.
For the last 13 years, Sue Ingraham has been suffering from a mysterious, agonizing pain in her hip and leg. But doctors have told her it's the result of bursitis, or possibly advancing age.
This orthopedist suggested that I keep taking the ibuprofen as needed and told me really, at this point in time, there was nothing that could be done.
It was really difficult to sort of grasp the idea that she was, hurting for so long.
By the fall of 2002, the pain has begun to affect her work, and Sue's forced to make an extremely difficult decision.
I had switched from working with children into the administration in the secretarial field because my left leg would not bend enough in order for me to sit cross-legged like we have the children sit.
While her new job takes some of the pressure off her leg, one day in the fall of 2003, after moving some boxes, an alarming new symptom strikes.
I had an excruciating pain for the very first time in the groin area. I couldn't even touch that area. I mean, it was so tender. I made an appointment with our new family physician, and he wanted to do a CT scan. So he scheduled that right away. I could tell he was determined to come up with an answer for why I was feeling the pain that I was in. It was a wonderful relief to have somebody finally take me seriously.
The doctor is confident that Sue has a hernia, but they'll need the CAT scan findings to confirm his diagnosis.
I got a call in the evening about 7 o'clock, and I remember seeing the doctor's name on the caller ID, and I knew if he was calling me at night that something serious was going on. He proceeded to explain that I had what they suspected was a very large tumor, down in the sciatic notch. I don't really remember much about the conversation after that point because I think at that point I was kind of in shock. I knew having a large tumor was not a good thing, and so I didn't know what the future was going to hold.
Suddenly, the clock is ticking. It's imperative that they determine if the tumor is benign or malignant right away. So the doctor refers Sue to an orthopedic tumor specialist at the University of Washington in Seattle, Dr. Ernest Conrad.
She sent me records to review prior to her clinic appointment. When they did the initial CAT scan of the pelvis, they could see a soft tissue tumor in the left pelvis near her hip joint.
It was kind of bittersweet because I knew all this time that there was something really wrong with me, so I felt validated, but also really scared.
Dr. Conrad explains that he'll need to biopsy the tumor to find out exactly what they're dealing with. But the biopsy isn't going to be easy. Because the tumor has grown into the nerves in her hip, the extensive surgical procedure could leave Sue's left leg paralyzed.
There was at least a 50% chance that she would lose the main nerve to that leg and most of the function in the lower part of that leg from that tumor associated with her nerve.
I was pretty devastated. I was trying to get myself mentally prepared, trying to think about what I needed to do in case the outcome wasn't good. At that point in time, I decided not to tell my children. My youngest was in college. I didn't want to worry her. I wanted her focusing on her studies. And my oldest just would have been intensely worried, so I just didn't want to tell him anything.
I had no idea that any of that was going on while I was in school. She's always been very quiet about it.
I was really concerned. She was my best friend. We were together every single day.
A few weeks later, Sue makes the 220-mile trip from Kennewick, Washington to Seattle for the surgery. It's a day she'll never forget.
I remember being wheeled in. I remember thinking that life as I knew it might very well change that day. And then I think at that point, I just chose to tune it all out. And I don't remember much after that.
For the past 48 hours, more than half a dozen doctors have tried to identify exactly what's causing Avery Williams' little body to go haywire, all to no avail. Now, one doctor in Salt Lake City has a hunch. The problem is, he's 250 miles away.
On that ride down, it was all I could do to just try to hold things together emotionally and just get myself ready for what I might be facing when I walked in through the doors.
In the meantime, Dr. Michael Pulsifer is anxiously awaiting his tiny patient. He's been carefully reassessing Avery's chest x-ray the Idaho doctors sent over.
Avery, she just didn't seem to be right in many ways.
As soon as Avery comes through the doors, Dr. Pulsifer starts his own investigation by ordering a new round of x-rays.
We repeated x-rays of all of Avery's bones. The x-ray of a normal person has a fairly thick demarcation of solid bone. And inside of that is bone marrow. What you should see is a very white outer layer with this clear marrow space. In Avery's case, it looked like a bone inside of a bone. It was very troubling.
While a few of the Idaho doctors initially suspected that the bone marrow anomaly could indicate the presence of leukemia cells, Dr. Pulsifer doesn't think the x-rays fit the typical leukemia pattern.
This was a very unusual situation, and we had to figure it out.
She was really sick. She was pale. She just wasn't breathing very good.
We didn't know how much longer we were going to have with Avery. We just wanted an answer as to what she had.
The next morning, Dr. Pulsifer announces his new game plan. He's going to run a series of highly specialized blood tests in the hope that the findings will give him the crucial clue he's been looking for.
The blood work again showed a very high white count. The white cells are what our body uses to fight infection, and generally it's relatively low. Clearly there was a disease going on of the bone marrow. That was very clear.
Marrow is a substance found inside bones. It resembles blood and contains stem cells, which carry oxygen, fight infection, and control bleeding. As a next step, Dr. Pulsifer needs to remove a small sample of Avery's bone marrow to help him pinpoint exactly what's wrong.
I was just sure she was gonna die. That's what I just kept thinking was, what can I do with her before she dies?
The next 24 hours are excruciating. All the family can do is wait and hope that they have the courage to deal with Dr. Pulsifer's diagnosis. When the results finally come in, he knows that he's found the clue he's been looking for.
I've seen pictures of it before, but I'd never actually seen a patient with the disease. It's exceptionally rare. In the bone marrow biopsy, as we reviewed that with our pathologist, they confirmed it, and we felt quite confident from that point about our diagnosis of osteopetrosis.
Malignant infantile osteopetrosis is a rare, life-threatening congenital disorder characterized by abnormally dense bones. In healthy individuals, bones go through a continuous cycle of remodeling, in which old bone is removed and replaced by newly formed bone. But in Avery's case, the cells that break down old bone, osteoclasts, are defective, so the bone just keeps building up. Eventually, this begins to cramp the bone marrow and nerves that pass through her skull.
The diagnosis, it was crushing to me. I didn't want to accept that this was something that my daughter had.
Dr. Pulsifer is confident that Avery's incessant crying had nothing to do with colic. Terrible as it is for Amber and James to stomach, it's likely their daughter has been in a lot of pain since the day she was born.
I was just so shocked. I just couldn't even think straight.
This particular disorder involves nerves running through bone, and the bone, when it remodels, accommodates nerves that run through it. But if it doesn't remodel appropriately, then those nerves are squeezed and pulled and twisted and cause pain.
In fact, every symptom, including Avery's enlarged head and bizarre veins, can be linked to the diagnosis.
The abnormal shape of Avery's bones is associated with the disease. If the bone is only growing out and is never remodeled appropriately, then areas are going to bulge out in a very abnormal fashion. And when that occurs, these veins are going to become much larger than they would be otherwise.
Even the strange blue tint in the whites of her eyes is a common occurrence in patients with osteopetrosis.
And we really do not know why they get this particular color to their eyes.
On average, only 100 children are born with malignant infantile osteopetrosis each year in the United States. It can be devastating if not caught early. Given that their disease-fighting bone marrow is impaired, children with osteopetrosis often die from a fatal infection.
When parents hear the implications of this diagnosis, that their child will, without appropriate treatment, be blind and be deaf and almost assuredly die somewhere in the first years of life, it's just horrible to hear a diagnosis like that.
I was having a hard time wanting to bond to her at that point. I was afraid she was going to die. I wanted to love her as much as I could, but I also wanted to distance myself emotionally.
Avery's only hope is to undergo a bone marrow transplant. Immediately, the hunt is on to find an acceptable donor. They start by testing Avery's brother and sister, but Dr. Pulsifer reminds them that statistically, they only have a 30% chance of finding a match with one of her siblings.
We called all of our family and extended family and asked for their prayers because we needed that 100% bone marrow match.
Almost 72 hours later, Dr. Pulsifer makes a call that the family will never forget.
First words out of his mouth are, "James, we have a match. It's Christian." We were just ecstatic.
The next month is a whirlwind. Avery undergoes the bone marrow transplant, but it doesn't take. Undeterred, Dr. Pulsifer repeats the procedure, and the family begins a prayerful watch, hoping that a second pass will do the trick.
We thought, if this doesn't work, I don't think anything will work, and we might just have to take her home and keep her comfortable until she died.
Then, on March 4th, 2003, the family gets the news they've anxiously been waiting for. Dr. Pulsifer pronounces the transplant a success.
We thought, oh, there's so much hope now. She's going to live.
But no one could have prepared them for what would happen next.
Finally, with her white cells back, she had the ability to heal. But when they came back, they did healing to an nth degree and released what we call inflammatory mediators, or proteins that are normally used for healing, but when released in high amounts cause all sorts of symptoms. Her lungs became extremely swollen. She went into renal failure and became about as sick as could be.
She had so many wires and lines going into her that you couldn't even get near her.
I remember just gently stroking Avery's head and whispering to her, Avery, it's okay. If you need to go, you can go.
48-year-old Sue Ingraham has just been wheeled into the operating room. Surgeons have located a large tumor growing on the nerve that controls her leg, and they're about to perform a biopsy to find out if it's cancerous. It's a grueling 3-hour procedure that could leave Sue paralyzed.
I just didn't know how I was going to deal with all of this.
In the OR, Dr. Conrad carefully extracts the entire tumor and then sends the tissue sample to the lab for testing. Within the hour, the pathology results are in.
We were fairly confident it was a benign or low-grade tumor under the microscope. She's really fortunate that she had a less active tumor. If she'd had a malignant tumor, that tumor would have grown and metastasized within a year, and she wouldn't have survived.
Not only is Sue lucky the tumor is benign, she's extremely fortunate Dr. Conrad found the tumor when he did. Had it remained undiagnosed, Sue would most likely have suffered permanent nerve damage and possibly lost the use of her left leg.
I knew I was one of the lucky ones because I now knew that I was going to live. I knew I was going to make the best of whatever outcome I had.
Based on the results of Sue's initial biopsy, we made a diagnosis of neurofibroma.
Neurofibromas are rare, benign, slow-growing tumors that can grow out of the cells that surround a nerve. In a healthy individual, the nerve distributes sensations and impulses throughout the body. But in patients like Sue, the neurofibroma compresses the nerve, triggering severe pain and weakness. The cause is unknown.
A neurofibroma is typically a solitary tumor associated with a nerve. They all have benign and malignant variants. Most of the time, they are benign tumors that do not act badly, and they do not metastasize, and their recurrence rate is pretty unusual.
I knew all this time that there was something really wrong with me.
Suddenly, all the mysterious pain Sue has been enduring for the past 13 years makes sense.
Sue presented with some diffuse pain around her pelvis, pain in her foot, pain in her knee, pain in her hip. I don't think there's any doubt that this particular tumor was causing all of those pains because of its direct compression and pressure on the sciatic nerve, the major nerve that's deep in the middle of your pelvis. It innervates almost all the muscles and contributes almost all the function below the level of your knee.
For the first time in more than 2 decades, Sue can imagine a life without pain. But now, she can't help but wonder why it took so long to put the seemingly simple pieces of the puzzle together.
Most doctors haven't seen a nerve tumor of the sciatic nerve and don't even think of the sciatic nerve in between the back and the knee. They'll think of a tumor in the knee, they'll think of a herniated disc, but they won't think of a tumor in the pelvis or near the hip joint. Making that connection is pretty challenging.
10 days after surgery to remove the growth, Sue is on the road to recovery.
It felt great. It just felt so good to be able to be up on 2 feet, see that they were both working, and knowing that everything was going to be good from there on.
Sue's follow-up involves multiple MRIs. We've done that for 4 years now, and we'll probably back off now and follow her every 2 or 3 years. Just as long as she doesn't have any increased pain, she's probably fine.
For the first time in so many years, I could do anything. I just didn't get tired like I used to. I didn't have pain. I felt like Dr. Conrad had given me my life back.
5-month-old Avery Williams is hanging on for dear life. What doctors first thought was meningitis is in fact an extremely rare and potentially deadly bone disease. After undergoing a successful bone marrow transplant, her fragile body has suddenly started to crash, and her organs are failing one by one.
They pulled us aside and they said, we've pretty much done all that we can.
She was extremely sick. We did not expect her to make it.
Shaken to the core by the tragic turn of events, the Williams family can't bring themselves to leave her side. Hours turn into days, and days into weeks.
We really began to question what the end point for Avery was going to be.
Then, 100 days after she was first admitted to the hospital, Avery does something no one ever expected.
She opened her eyes and she started just making these sounds, which she hadn't done for months.
Oh, it was a hallelujah. We just knew at that moment that that was a good sign.
She very slowly showed us that she wanted to get better by fighting each day.
When Avery came to and her eyes were open, we could see something wasn't right with them. So the first thing they wanted to do was test her vision.
Well, we ultimately found that she lost most of her vision.
Dr. Pulsifer suspects that in between the bone marrow transplants, Avery's optic nerve was damaged as her skull grew thicker and thicker from the osteopetrosis.
Nerves in our central nervous system don't repair themselves. So if your nerve to your eye or your nerve to your ear get damaged seriously, they're gone for good.
Given everything that Avery had been through up to that point, blindness really seemed like something that we could deal with.
We stepped back and started counting our blessings. I have very rarely seen patients who have gone through what Avery went through survive.
While Amber and James are grateful that Dr. Pulsifer was able to solve Avery's case and save her life, they still struggle to understand why so many doctors weren't able to put the pieces of the puzzle together sooner.
When you see a doctor at first, they're going to think of the most common things that can occur. Your child is fussy. Well, maybe they have colic. Prior to Avery coming to our center, we had had one other case, and this child was quite sick and unfortunately passed away.
If I could tell other parents who are having, problems with their children they can't explain, I would tell them to just go in and ask their doctor, go in there with a list, keep notes, keep track, be dramatic a little if you have to.
Today, Avery is a rambunctious 6-year-old who continues to amaze her family.
Avery today is exactly as she was from day one. She's a fighter. She has some sight, and really she gets around almost as if it's not even an impairment for her.
Avery amazes me. I couldn't even tell you how many pieces of music she can play.
I can't imagine our life without her. It wouldn't be as fun at all.
My hopes for Avery, I want her to live a healthy, long, productive life, surrounded by the people that love her most.
Today, Sue is back to being her old active self. She's working full-time and enjoying all the physical activities she was unable to do for years.
I can ride a bike, I can do yoga, I can do anything that requires strength in that left leg that before I couldn't do.
It's definitely made me look at my mom in a different way because, I grew up with her always being in pain and never realizing what she was going through. I think being able to identify with that kind of perseverance has really shaped who I am.
One of the wonderful things that I have in my life again is enjoying the outdoor life without any limitations. I would suggest to anybody who's experiencing chronic pain to just keep pursuing different doctors until you find somebody who takes your pain seriously. And you have to be your own advocate.